Plastic surgery.
And welcome back to Talk of Alabama. We're excited to have Dr. Daniel Russo in the studio this morning talking to us about an incredible new device called PiXel 8. So this is interesting. I've been reading about this, doctor. Tell us all what it's about.
Well, you know, it's really a neat new technology,
Yeah.
Nicole. We're always looking for something that, you know, can make people look better without as much downtime.
Yes.
That's what we're all about. And this particular device, PiXel 8, is a combination of a microneedling device that also has radio frequency built into it. So it has very, very fine needles that barely pierce the surface of the skin, virtually no pain at all. This is one of our patients, and they're doing it right now as they do it, and she's virtually got no discomfort. We put a little topical numbing medicine on. There's really not much downtime at all. A little bit of redness right afterwards, but they can get back into their normal activities right away. It usually takes 2 or 3 treatments to get the best effect we can get, but it really is kind of a nifty device because there is no downtime at all with this.
So it's stimulating essentially collagen, right? And then it's helping overall tighten the skin.
That's correct.
So
That's right.
we're looking obviously at some results right here. What a difference!
These are some patients. You can see it on the neck especially, how she had the crepiness on her neck and the laxity in her neck, and it really made a nice improvement on this particular patient. Another patient, that's just, there she is before and after.
Yes.
And it's nice because it's not a huge, big transformation. A lot of
Yes.
patients are scared. They're afraid they're going to look like a different person, and
Yes,
it
so-
doesn't. It just sort of takes them back a few years, which is kind of a nice thing without having a lot of downtime.
Yeah, I love that. And you can wear makeup, what, the next day or a couple days after?
Oh no, the next day is
The next day.
absolutely. You can do it on scars as well, and it's helpful to improve scar tissue. And patients that have acne scarring, it definitely can improve
Yes.
that also.
Now, what about something that we can do to enhance the results of that?
Well, that's another thing that we're using, that we've been using for a while also. PRP, or platelet-rich plasma.
Okay.
Patients may understand what that is if they've had some joint problems. Orthopedic surgeons have been using that for years to inject into joints. If you take blood out of your arm and process it, spin it down, we can concentrate the platelets in the blood. And platelets have healing properties and there's special properties that help us heal, but they also can stimulate collagen production as well. So we take that concentrated platelet solution and we re-inject it into the face, or we apply it on the face when we're doing the PiXel 8 procedure. It helps stimulate collagen. We can use it for other things as well. We use it to help stimulate hair growth. In patients who are losing their hair, you can inject the PRP into the scalp. This picture just shows how the PiXel 8 works. It's got multiple little bitty needles, and as they penetrate the skin, it actually passes a little electrical current which heats up the skin, and also with the PRP can stimulate even more collagen production.
Well, and you know what, it's interesting. It's just as many men nowadays that are wanting to just kind of shave a few years life. It's not just women that are
Absolutely.
getting this done, right?
No. We do a lot of men as well. Of course, we do some hair restoration, hair replacement for men, but we do that for women too. But we do a lot of other rejuvenative procedures for men too. It's very, very vogue now for the men to want to do this. It is, especially with the non-invasive things like this.
That's to say, quick. Now, the second thing that you mentioned, the PRP, does that take a lot of downtime, or what is that like?
No, that's very, very quick. We literally draw some blood like you would if you go to the doctor and have some blood drawn for a lab test.
Okay.
We have to process it. We spin it down in a centrifuge, which concentrates the platelets. It takes about 20 minutes to do that. And then we just re-inject that concentrated platelet, typically into the scalp, to help stimulate the dormant hairs that are not growing as much as they should. Or we'd like for them to anyway.
Yeah, that's true. Well, and if somebody's got questions about this, say a viewer at home is watching right now, and they're like, that might be something I would want to do. How do they contact you?
Well, they can go to our website. This is drrusso.com, and that's got a lot of information on it. And then, of course, they can call the office too and schedule an appointment if that's something that they're interested in doing. But our website has just a a vast amount of information on it about all the things that we do, and I would encourage them to spend some time there, because I think they'll get a good overview of some of the things that they may be interested in.
Okay, and the bottom line is you specialize really in the neck up, right?
That's all I do. I just do facial. I've done that really since I started my practice over 30 years ago. So we've been doing this a while, and I love doing what I do, and we've been able to really specialize in just the facial surgery. And so I really feel like our patients are getting good quality care, and I've been involved with this on a national level for many, many years. I was a past president of our National Facial Plastic Society, and so we try and keep on top of the latest developments in what we're involved with.
Okay, I've never had any face work done, but if I did, I always tell them that I would go to him first.
Well, you don't need me.
I don't have it, not yet. Let's put it that way. Thank you so much, Doctor.
All right, Nicole.
DrRusso.com. Check it out today. Don't go far. We'll be right back.